Hello and welcome to WP. Well, COVID-19 has wreaked havoc across the world, and in WA, life has been defined by one word: uncertainty. As we reach the end of a year impacted by the pandemic, we talked to National AMA President Dr Omar Khorshid about the year and a look forward, especially for youth in 2021, in part 2 of our 2020 look back.
It's been quite an extraordinary year, hasn't it? The once-in-a-lifetime global pandemic, first in proper one really in 100 years, has taught us a lot, I think, about how we value our health. It's tested us as a community. It's shown us that we're actually willing to, as Australians, to do things that are inconvenient for us because they're good for others, for the vulnerable in the community. And I think that's a really heartening lesson. We've also learned a few new skills, fist bumps and elbow, I'm not sure what you call the elbow thing, but whatever that thing is we do with our elbows. And really quite an extraordinary year, but one I think that none of us will forget in a hurry.
Do you believe our young people are very resilient this year?
I think young people have been tested this year, whether you're at school, you're at university, or you're out and about in the workplace. There have been huge changes, stresses with the worry about job security, unemployment, your whole world changing beneath your feet. Worries about opportunities for travel and all the things you might have looked forward to, even if it's leavers celebrations at the end of year 12. So much disruption, but I think the good news is we're now nearing the end of the pandemic with vaccines on the horizon. I think people see the light at the end of the tunnel and are looking forward to 2021 being a little bit of a different year.
Looking at the federal level, because you are the national president of the AMA, how do you rate the government's handling of the coronavirus? Was it well coordinated or not so well coordinated?
Look, it's easy to be critical of governments, but at the end of the day, here we are in Western Australia, in fact in Australia, having dealt with this virus better than almost anywhere else in the world. We've kept our economy going. Many of the jobs that were lost early on have come back. Most of our population's been safe, and apart from a few missteps along the way, and yes, government have needed to be nudged by the AMA, amongst others, to do the right thing, but we've got there in the end, and I think once this pandemic is over, we'll be able to look back and say what an extraordinary job, not just the government did, but all Australians did.
Given the current trends of what has been unfolding, what do you see happening next year?
I think next year is going to be a good year. It's going to be a year in which we are rolling out a vaccine to our entire population, something that's never been done before. And it's going to be a year in which we start to relax a little bit on the worries about COVID. And it's going to be a year that, towards the end of which, we might even be able to see our international borders opening, the ability to go on holiday again and for students to come and study in Australia. So really looking forward to next year.
If you have to describe young people's suffrage this year in one word, what would it be?
Uncertainty.
Uncertainty. Why?
Because everything's uncertain. The things that you take for normal, your ability to go out and see your friends, to see family, the ability to go and have a meal, the expectation that you're going to have a job at the end of your study course, or the ability to go and get short-term, part-time work in cafes or restaurants. Everything's been thrown up in the air. Some young people have had to go back to their parents' homes. It's been a very difficult year in which to put down roots and be certain about your future.
Finally, what's the takeaway for 2020 for every Australian who's watching this? What do you have to say?
What I'd say to every Australian is just remember through this year how much you've valued your health. It's been extraordinary how we've been able to set our public policy by what the experts, the health experts, have said needs to happen, and governments have done it, the public have done it, and they've said that we value our health. So let's remember that as we go forward and start to talk about your smoking rates or how much sugar you got in your diet or other things that you need to do as an individual to stay healthy.
And now, here is AMA WA President Dr Andrew Miller with your COVID-19 update and commentary.
Hi, thanks for your time. Quick recap of what's happened in the week of COVID as far as West Australians are concerned, where we're lucky to be disease-free. Although, of course, we're seeing some in hotel quarantine, which is to be expected because the number of the cases around the world is starting to rapidly climb. So we're sitting around 72 million known cases so far around the world. It would be reasonable to, say that that's a vast underestimate. possibly up to 500 million people now have had the disease. And certainly, unfortunately, high numbers of known deaths, around 1.6 million. And currently we would say estimates around the world of around 100,000 people who are critically unwell, and in some places, of course, that's starting to overwhelm hospital systems. Now, these numbers are all a little hard to get your head around, but we do know that in advanced countries like the United States, we're seeing overwhelm of ICU in some places, and if they can't handle these sort of numbers, then nobody can, because they have got a very good healthcare system. Despite what you might read in the media about things, they are very well equipped to handle large numbers of sick people. But in California, seeing 29,000 new cases a day. Texas, 20,000 cases a day. Those sort of figures become unsustainable, and hopefully they'll be able to get some control over that using social distancing. But they don't have the same approach to it that we had in Australia. We have the luxury of a very small population, of course, but we also sensibly took the scientific advice at the start that the best thing to do with this disease was to control it until we had either treatment or vaccine. And they don't have that option anymore in the US. Now tracking and tracing and so on becomes far too difficult in those circumstances. So we see now that the Centre for Disease Control is reporting an excess death rate, which means that there's a much higher number of deaths than they would expect to see month on month in the US now. So we know that that is in some way due to the hospital system not being able to treat common and garden problems that we have every year, such as heart disease and so on, in an efficient way because of the load of COVID, but also that represents the number of people, unfortunately, who are dying of COVID. I say all of this not to scare people. I say it to reflect the importance of continuing down the path that we're on, because whilst everything seems to be going well here, we do start to have people who wonder, well, is it all worth it, the restrictions that we've had, and hopefully the unwinding of the interstate travel restrictions to everywhere except South Australia now, who still can quarantine at home for 14 days but come into the state without needing a particular excuse. Hopefully that's been a very important advance for those who've been missing family and for lots of other reasons haven't been able to be together. And so it's terrific that people are able to travel, but that's only because of the success of our border control and our measures so far to keep this under control. Really important then in that circumstance that our hotel quarantine be of very high quality, and we'll continue to press the government to say that we need better PPE, we need more testing going on there, we need to be thinking about better airflow within hotel quarantine. On the vaccine side of things, been a lot of news about that this week. The University of Queensland vaccine was one of many candidates that are coming forward, one of 4 candidates from within Australia itself. So sometimes you get this impression from the media that we're only talking about one in Australia. Well, no, there's quite a few different options within Australia, and then there are many more from around the world that are still continuing forward. The US and the UK, of course, have brought their vaccines in a bit earlier under an emergency authorisation, and they'll be watching patients who are receiving them very quickly. So AstraZeneca one in the UK, of course, out of Oxford, is one that there's a lot of interest in Australia, and we do have agreements to get that vaccine. Questions around its effectiveness. We need to see how effective that vaccine is going to be. It's a fairly easy to transport vaccine, doesn't need to be at extremely low temperatures. And we did see some reports of allergic side effects in people who'd had severe allergies previously early in the rollout. That's to be expected though, that we'll see those, but we need a lot more data about it. We need to know a lot more information about the appropriate dosing of it, and we need to know how effective it is in all the different age groups. And that's why it's really important that we have this period of time in Australia where we do have the disease very much under control, and we can now get all of the information about the best way to proceed with the vaccine, whether that's going to be one of the American ones that do need, like the Pfizer vaccine, that do need extremely cold storage, and therefore we'd need high-tech eskies to move that around, or whether it's going to be one like the AstraZeneca one or a completely different one. It may well be that of the tens, dozens of candidates of vaccines, the Russian one, there's a new Russian UK collaboration, lots of different ones. It does bring out the anti-vaxxers and the no pandemic people, I call them, the people who say this is all a bit of a hoax, and very important that there be sensible responses to those things, but don't give them too much attention. So there tend to be a lot of lies told out of the no pandemic group, and often they can sound very reasonable, and they come from people who look like they're scientists or are scientists, are doctors, and that sort of information though is just dangerous, and we do need to put that in the bin and carry on with moving towards a safe and effective vaccine. We need to be polite to those people, but we don't engage with them in a respectful argument about things because they don't accept the underlying science, and they don't accept that there's a lot of people, unfortunately, who are getting critically ill and who are dying of this disease at the moment. So we need to move forward with the vaccines, but Australians can relax knowing that if we keep doing the right thing with our border controls, our hotel quarantine, our ships that are coming in, our international flight crews that are coming in, then we will be on an okay path. We're still not prepared enough with PPE in the hospital sector. I still don't think we have the right focus on ventilation yet, but with the US CDC coming out now that the election's over there, they seem a bit more emboldened politically to make free statements about things. They're talking a lot about ventilation. Really important to avoid stagnant indoor crowded spaces and to try and get better ventilation in the buildings. So let's work on all of that in the meantime. Keep our international border controls very tight and remain humble and respectful in the face of this disease. Thanks for your time.
And that's all for this week. We'll be back with another episode of WP next time, but until then, it's back to you.
Thank you, Nelson. And that's our weekly news and current affairs. We have the latest news on our website and social media pages.
No matter where you're watching, Sarah and myself wish you good health and good night.
Take care.